Okay, so now I'm going to talk about what parents and families need and where their priorities lie in terms of services and supports. Understanding this can help provide recommendations for decision makers and can help inform policy on supports that may be the most effective in addressing families' most urgent needs. So our third question is, what are families' service and support needs? So before we look at their service and support needs, we were interested in examining their satisfaction with existing supports and services, which include the new policies that were implemented by the government during the pandemic. So some examples of supports that were implemented by the government were $225 in emergency funding for respite, 35% of autism funding usable for equipment, a 3-month extension of autism funding, family counseling or therapy, and virtual therapy provided by service providers, including occupational therapists, speech language therapists, behavior analysts, and counselors. So on the y-axis here, we could see the ratings or the helpfulness ratings of MCFD supports, where a 0 indicates not helpful at all, a 1 indicates not that helpful, a 2 indicates helpful, and 3 is very helpful. So we could see that across the different age groups, the helpfulness rating for MCFD supports is quite low. It's around 1. A little bit over 1 in this 1 to 6 age group. So it's quite low, and there was a significant difference when we compare the helpfulness of MCFD between the 1 to 6 year age group and this 13 to 18 year age group. There was also a significant difference between the 7 to 12 year age group and the 13 to 18 year age group. So this group, the 13 to 18-year-old group, rated MCFD supports the lowest. And this could be due to a number of reasons. It may have to do with the decline in funding. There are also other interpretations. This 13 to 18, this marks a transition period into high school and post-secondary, which can be very challenging. And this particular age group and their families might require much more supports than is currently available. And this slide here, we also assessed parents' families' satisfaction with the Ministry of Education supports. So some examples of supports implemented during the pandemic from the Ministry of Education were childcare for essential service workers, online instruction by classroom teachers, special education assistants, specialist teachers, including counselors, alternative approaches for continued learning for a child with challenges working online. There was the meal service program, the website Keep Learning BC, where families could find ideas for educational activities for their child. There were live and recorded webcasts from Popard and information on how to talk to their child about COVID-19. So again, when we look at the y-axis, a 0 is not helpful at all, a 1 is not that helpful, 2 is helpful, and 3 is very helpful. We see a similar pattern where this 13 to 18-year-old age group is showing the lowest satisfaction with the Ministry of Education supports. And this group in particular was significantly lower than this 7 to 12 year age group. So parents commented on when asked their reasons for their ratings, parents commented on not meeting eligibility criteria for these and the government supports that were provided, or the excessive paperwork that they had to fill out, not being able to find the applications. A substantial number of parents also did not know about these supports that were available and said that this survey was the first time they heard about any of these supports, which is really not good to hear. We were also interested in hearing caregivers' perceptions on the types or the characteristics of government supports that were needed. So we coded participants' open-ended responses on this survey and then counted the number of times or the frequency that each of these different types of themes or different types of services were mentioned by parents. So the most frequently mentioned type of supports needed was respite. So an example for responses indicating a need for respite was from one parent who commented, we had to lean on every resource we had with family and friends to give ourselves a break from our son, since he is very needy and requires constant supervision. Since we were denied respite through an application for disabilities, we thought we had no options for respite. This would have made a huge difference for us. So 46 caregivers identified this as a priority. The second most frequently identified type of support was for centralized information. So one parent shared, it would be helpful to have information with links to applications, clear outlines for who qualifies, and simple processes to obtain access to resources and supports. So 44 parents mentioned the need for centralized information, a place for all of this information to be held. The third most frequently mentioned type of support or characteristics of supports needed was flexibility in funding. So this was seen as a priority. So parents mentioned strict eligibility criteria, not allowing them to pay for materials or equipment to support their child's learning, or exercise equipment that they needed. So one parent commented, I was very upset I wasn't able to access equipment. It would have made a huge difference in my child's and my whole family's life by helping him. I'm very disappointed in that whole process. Another identified need from caregivers was for emergency or safety support. So when their child or when their children were displaying aggression, self-injury behaviors, or real threats to their own or their family's safety, a lot of parents mentioned that they would have wanted more immediate and more urgent help. So one parent commented that their son became physically aggressive and violent, as well as starting to threaten to harm himself. I had to do suicide assessments on my own child. In our survey, we also asked what educational supports or supports from the Ministry of Education that they specifically needed. So the most frequently mentioned type of support was for an educational assistant to support their child's learning. So some parents mentioned how critical having this person was in their child's transition to online learning during the lockdown. So one parent shared the daily check-ins with his EA were essential for him to stay connected to school. So 38 parents identified this as a priority. Some parents also mentioned that online learning was not possible at all for their child and required in-person learning support. So one parent said, my son needs hands-on therapy and learning with someone in person. Virtual learning is absolutely impossible for my son due to his disability. So 38 caregivers identified this specific type of support. And 26 parents drew attention to the importance of individualized instruction consistent with their child's IEP plan, their individualized education plan. So some parents believe that their child's IEP was ignored or not seriously considered when schools were shut down. So for example, one parent said their son's IEP was not taken into consideration when making his educational plan during COVID-19. And the last theme or the last type of support identified or prioritized was the need for funding for educational supplies and equipment. So children, they can't participate in learning. They do not have an equal opportunity for a proper education if they don't have the tools and necessary equipment to engage in learning. So this was really important for parents and their children. So one parent was quoted as saying, the programs the school ran needed an Apple device for many reading projects. I tried to access the funding, but they would not approve this purchase because it was only if you had not purchased equipment in the past 3 years. I could not understand why I could not claim the additional 20% to support my daughter for online learning. So 17 caregivers identified this as a priority. And our last, the last question that we asked related to this was the types of information that caregivers needed. So given the amount of information and also misinformation that became available during the pandemic, as well as the rapidly changing guidelines and safety regulations, we were interested in understanding what types of information was prioritized by families. So this can help support groups and websites run by community organizations such as ACT prioritize what types of information they make available to families. So we found that the most prioritized type of information for caregivers related to parent support groups and where to find them. So a few parents shared how alone and isolated they felt. So having an outlet to connect with other families was perceived as useful to some caregivers. Learning about parenting tips and hearing from other parents and families about what works for them and what didn't. A number of parents also requested information about mental health resources, whether it was for themselves, their child, or their family as a whole. So one parent mentioned a kid's mental health app or line for just helping kids with questions or anxieties, but that aren't necessarily an emergency. They have something for adults, so why not kids? So a lot of parents mentioned solutions and provided a lot of useful and insightful suggestions like these. Some parents also prioritized information about social groups for their child to participate in virtually. So for example, one parent said they would like to see more online social groups for kids with similar interests. For example, Minecraft, Pokemon, transit, and as well as how to make contact with other students from school who live in the neighborhood. And I think that the responses that were coded under this theme of information really highlights the need for parents to connect with others in the community, to support their mental health. And while some of these spaces do exist, a lot of parents are not informed about these or know where to find these types of supports. So in summary, caregivers of 13 to 18-year-olds in BC report the lowest satisfaction with government and educational supports. Parents prioritize government supports such as respite, having a place for centralized information, flexibility in funding, and having emergency or safety supports. In terms of their child's education, parents prioritize supports from educational assistance for virtual learning, having in-person learning options, and having individualized instruction consistent with their child's IEP, and funding for educational supplies and equipment. And caregivers prioritize information related to parent support groups, mental health resources and supports, and social groups or activities for their